When I was 18 weeks pregnant, they sent me to a fetal maternal doctor to do a level 2 ultrasound. And during that ultrasound is when they saw that one of Jacob's kidneys were blocked. And they scheduled another ultrasound for 3 weeks later. And during that ultrasound is when they noticed that he had bilateral blockages on his kidneys. They were both enlarged. From that point on, we were getting ultrasounds done every week, and it gradually got worse every day. And at 27 weeks, I went into the doctor, and I had lost all of my amniotic fluid. They immediately admitted me that day, and we stayed there till he was born at 34 weeks. They went ahead and inserted a dialysis catheter when he was 5 days old, and at 7 days, they gave it 2 days to heal, they started dialysis. He came home 2 months after he was born. When we were doing dialysis here at home, it started out 12 hours a day dialysis, and then we would slowly go down to 10, and then we went down to 8.
They knew that he would need a transplant.
Yeah, Jacob weighed 5 pounds and 14 ounces when he was born, and our goal was to get him to weigh 22 pounds in order to get to that point where he would even be eligible to have a transplant. He was not gaining the weight needed in order to get the transplant, but his health was declining quickly. The doctors made the decision that he had to be transplanted. And at that point, we had started the screening for living donors. My husband was immediately ruled out because of his blood type. I knew I wanted to be evaluated, and other people had mentioned that they wanted to be evaluated to see if they could possibly donate. But when it came time to do it, I didn't know how to ask them.
I called her and told her, look, you don't have to ask me, just let me know when. And she said, okay, and of course she started crying.
So Mary was the primary person that was going to be number one if she was eligible. And the blood work matched up fine. They started looking at a few vessels that were arteries on her kidney that they said was a little spread apart, a little farther than they liked. So when they connected the kidney, that she wasn't the best candidate.
I just called my brothers and I said, you both are perfect matches. And my oldest brother, Eddie, was just gung-ho. He just wanted to do it. I wanted to make sure that he fully understood what he was going to be doing and the process that was going to be taking place, because I was so worried about him, even though I was worried about Jacob. But when it's another person you love.
I'd never had any major surgery. I was afraid of not waking up. You know, from the surgery, I was like, you know, they're going to put you under and I hope they can get me back. I was afraid that I would be a failure and my kidney wouldn't work. That was my biggest concern. After I met Dr. Newell and all the guys there, I didn't worry about anything. They told me this: if you are not 100% perfect for this, we won't do it. I had my surgery on Friday morning. I got out about 12. I got out of recovery around 2 or 3, I don't remember. Sunday afternoon, I was ready to come home.
Jacob had his transplant on October 21st, and we came home on Halloween Day. He was fully awake 2 days after surgery, and he wasn't himself, but he was talking. He wanted to talk on his cell phone. He recovered very well, just as my brother did. It was an immediate change of how good he was feeling.
And I love him dearly. Can't wait to go to school for the first day and has a little girlfriend and, you know, whatever he gets into. That's what it's supposed to be like.
When I'm trying to give Jacob his medicines, I've explained to him that, you know, Eddie offered his kidney and that we've got to take very good care of it, that we don't have another one to give you. We are going to the hospital for clinic for a checkup every 6 weeks, and he's getting his blood drawn every 3 weeks.
We definitely consider the nurses and doctors up there to be special people to do what they do.
We have been very blessed. Jacob has had a couple of colds. We have noticed that if he gets a cough, it stays around longer than what a typical child would have. We've tried to be very careful about who he's around, and if anyone is sick, they're not allowed to come here. At first, we weren't taking Jacob anywhere. But now we are slowly getting him out, and it's a joy to see him running around screaming. When most parents would be ready to pull their hair out, we just smile because for so many years he didn't do these things. He's very happy, and Mom and Dad are very happy.